27. Well,
And welcome to the Chat with the Docs. I'm Mo, acupuncturist at Siloam Center, who's currently getting sniped on an auction of a tree.
we're going to win it yet. Maybe it's not over yet.
This is Dr. Noel,
Hey, guys.
our chiropractor here. And hey, 30, not
30?
a penny more.
Okay. Good, that's the next bid. Winning. We got nine
I
minutes.
may have sniped him back.
We'll see.
Oh, the drama, which is Chat with the Docs. Welcome. This week is we're taking a little bit of a different track. As I mentioned last week, we're going to be changing each week and following a specific pattern of themes. This week is our Peak Performance series, where we're talking all things sports medicine for that weekend warrior, for the folks that want to get out and start moving their bodies a little bit, which from a Chinese perspective, one of our doctors that taught us in school, he was an avid fitness buff and former Golden Glove. The story behind that was funny because he says he would go into these fights and he would always be getting his clock cleaned until somebody would hit him really hard, and then he'd get angry and then he'd win. But he was this real sweet guy. But he showed us, he went above and beyond to show his students the importance of exercise for moving liver qi in Chinese medicine. Liver qi stagnation equates to lymphatic stagnation. Mm-hmm. And so when there's lymphatic stagnation in the body, immune response decreases.
Disease process
increases. Inflammation increases. Nourishment to the non-vascular tissues decreases.
Injuries
increase.
Yeah.
And so his point was just get your patients moving. Mm-hmm. And so we're going to be talking about those folks today. Next week, we will be talking about family medicine, probably focusing on topic all things pediatric. Let's talk about ear infections.
Yeah.
Ear infections in kids. It's always going on. We'll talk about the pathogenesis of it. We'll talk about what is typically used for treatment in allopathic medicine and why that stinks.
The antibiotics.
Should I be more blunt, or should I is veiling my feelings about things okay?
You can do that. This is our show.
We're going to talk about why the typical treatment protocols for ear infections stink. And it's setting the child up for a bad.
I have the typical, tons of pink antibiotics that I can still remember the taste of.
Yeah. And they set you up for failure. We'll be talking about that. Not only do we talk about the negative of why you shouldn't go following after traditional treatment, amoxicillin. No. We'll actually teach you some ways, some things you can do in your home to treat your child, and we'll also give you some things that we would recommend when you come to see us. Mm-hmm. So not only we are not your typical pundits. We are not your talking heads, because today you can see our kneecaps. We're more than just a head. One of the things that we try so hard to do is not just rant and rave and tell you how something is bad. We want to give you options. We want to point out the truth about something, but we want to give you some options. So today is Peak Performance, which is really cool, right? Today we're talking all things sports medicine. Now, I personally do not think of myself as a sporty person. I detest running. I hate it. I get so bored when I run. That, and I turn blue because I'm asthmatic. I don't like being a Smurf. But sports is more than just running. You've got people that like to play pickup games of basketball, football, people go
It's about
hiking,
being active and competitive.
being active, being competitive, even the folks that want to take their kayak and put it out on the river and go paddling around. All of this is exceptional stuff. You need to be doing this stuff, but there are some inherent risks involved. Risks of injury, risks of exposure. Say, how's that sunburn treating you, Doc? Speaking of risk of exposure, this is actually Dr. Noel, not a lobster that we picked up.
It went from Casper the Ghost last week to Miss Lobster this week. But this is exactly what we're talking about. You have little increments where you're working on things. You don't have one whole shot.
Yes.
And you get cellular damage, as you can see on my face.
Well, and not just, it's not just the acute damage that you have to worry about. You also have to worry about the cumulative factor of that damage. In the case of sun exposure, skin cancers. In the case of non-vascular tissue, the cartilage wear, arthritis.
Yeah.
So you've got to consider these things. A lot of folks will say, well, I just won't do anything. I'll stay in the house. Safer at home is over.
Yep.
Get out there. Start moving. But before you get out there, when I was training jiu-jitsu last year, my family, we stopped going because of some illness in the house and because of the flu season. Jiu-jitsu, you're in very close contact with people, and we just, with the other illness in the house, I didn't want to bring flu into the house. So one of the things that you are always hearing people talking about is, man, I'm on keto, man, it's going great. And you don't want to spar with them because they smell like an ammonia bottle. Well, that's because they're in ketosis and their body is producing ammonia. It's not just their body that's producing ammonia. It's also it's a biotoxin given off by some of the critters living in them. And it's not necessarily a good thing to be that far into ketosis where you stink like an ammonia bottle.
Yeah, you don't want to intentionally always remain there. It's good to have it as a backup for the body, but you don't want to be living in ketosis.
Right.
With the fruity breath.
Right. Fred Flintstone was just a cartoon. We don't need to live it out.
No fruity pebbles.
Yes. So you if you spend any time around a gym, either with the guys lifting their weights and or a martial arts dojo, people that are out cycling, if you spend any time around these people, someone's going to be talking about their diet and the latest and greatest fad. I have a very dear friend that I went to med school with who is an ultra marathoner. Personally, I think he's nuts. The guy will run 100 miles and nobody's chasing him.
Does he like running, though?
Well, that's why he's nuts.
Well, I was going to say, some people, they'll run and they hate running, which that always blows my mind. At least if he likes it, that makes sense.
I suppose they feel obligated.
I don't know. I think they like the results of it, but they don't necessarily like the process.
Well, this guy actually likes running.
Wow.
And he, as a result, he and a colleague of his actually developed an entire medicine based on a systematic pattern of collagen adhesions in the tissues and how to release them for the sports medicine world.
Cool.
Guy works on football players, professional football players, hockey, all those dudes. But one of the things that I always found interesting with him was, because he'd go out there and he'd try some of these diets, and this was back before anyone knew what keto was. And I was talking to him, and he says, "Oh, I'm trying keto, man, and it's all right, but I'm not sold on it." And the more I studied, the more I came to agree with what his findings were, and that was, hey, instead of jumping onto the latest and greatest bandwagon, maybe we should look at moderation. Maybe the food we eat should be I don't know, food,
Actual food.
not something processed.
Hmm.
And I have experimented with keto. My body tends to do very good on high protein levels. Some people do not. And so you put the wrong person on a keto diet and they are going to crash and they're going to have all kinds of trouble.
Well, probably especially those ones that are used to having a simple carb diet, and then you take it away and it's like taking a drug away from an addict because it's a simple sugar.
Yeah.
So,
So, well, and that said, you enter in that whole receptor center in the brain where the brain is giving a neurotransmitter reward for the stimulus that you're giving it, namely the simple sugars, and so then your brain truly has that addiction cycle begun. Not only do you have the addiction cycle in the brain that you're fighting, but any bacterial infections, any protozoa infections,
they're feeding off of that.
worm infections, all of these guys are saying, "Yay, give me the Twinkies." And sometimes it's not you that's hungry for it. Sometimes it's the critters living in you that are hungry for it. So keto is not necessarily all that it's cracked up to be for some folks, and some folks it's great. The whole point would be use moderation. Wasn't there a guy that was considered pretty smart, and didn't he write a book that was actually put into the Bible? Solomon, wasn't it? And didn't he say moderation in all things? It applies here too. It applies to diet. You don't want to go all hog in on just about anything. There's a time and place for it when you need some really harsh intervention. There's every other time though, use moderation, use some wisdom. And it's interesting because even the hardcore keto proponents are modifying the carb amounts that they allow you. It used to be no carbs, man, no carbs, just meat and fat.
I went to a nutrition seminar, and the one who was teaching it, and this is like to get certified for the state, he was saying that he was just eating a burger that night, nothing on it, not a trim person by any means. And it's just like, I think of the cholesterol and the effects with everything when you're doing.
Boy, he sounds fun at a party.
You know what I mean, though? It's like it would be one thing if you said I was gonna have a nice piece of like salmon or something like that, like a healthy fat in that, but I'm gonna have a cheeseburger with nothing on it. It's like
the problem I would have with that is the meat that he's putting into it is garbage.
Yeah.
If someone's going to have ground beef in a burger, fine. But
to say that that's healthy and that's what you're going to do for this diet.
That's right. That shouldn't be foundational. And the meat should be clean. If it's garbage meat, say you go in and you say to the McDonald's people, "Yeah, I want a quarter pounder neat." Is that how they say it? Is that, "I want a quarter pounder, no bun, no nothing. Just give me the quarter pounder." Okay, that meat's been heavily processed. It's full of hormones. It's full of garbage.
You're taking all that with.
You're getting all of the bad with it. Make sure your meat's clean. Now, if someone were doing keto and they were real strict about it, and they were watching their actual ketosis levels, you can kind of manage that fat a little bit better so that you don't have to worry so much about the cholesterol issue. But those are the people their bodies are real fine-tuned. Those are more of the elite level athletes. For the average Joe Schmo, and this guy, as you were just trying so elegantly to describe. We'll just say that he wasn't that much of an athlete. We'll just say that he was probably very sedentary. Uh,
Like most people are. There's not as many
very
physical
few people
jobs
have
anymore.
very few people have muscle tone, which is why there's so much structural injury. Someone sneezes and they throw their back out. We talked, I think, last week at length about core muscle stability. Well, when people are not exercising, their muscle tone stinks, their core strength stinks. But when their diet is being shocked in so many different directions, you're living off of that greasy hamburger and nothing else. That's a real shock to the system. Number one, you're going to be bound up, brother. You're going to be in real trouble. And if your bowels are not moving, how's your body going to get rid of waste?
Dissolving toxins and recycling them.
You're going to recycle them. You're going to be sweating some of it out, which is why some of these guys have some real problems. But you're just kicking it around, and it's not getting rid of the stuff, and it's creating pockets of inflammation around the body. You need to balance it. Dr. Bob Doan over in Washington State, one of the top 2 or 3 acupuncturists in the country. I would think of him. I would think of Dr. Chow, and I would think of Dr. Chen out of California, the 3 top dudes. When I think of the pinnacle of American acupuncture and Oriental medicine, it's those 3 dudes. Dr. Doan talks about how, and he's not going from a keto perspective. He's just talking about, resetting bodies with diabetes, having them eat organ meat, 1/3 of their plate being organ meat, and 2/3 of their plate being green leafy vegetables. That's more than just eating a hamburger patty. Organ meat. He specifically says organ meat. Why the organ meat? Any takers on that?
You're talking about like liver or heart?
Liver, heart,
okay,
kidney. The organ meat is more nutrient dense.
I think of iron. That's like a big one. That
more
pops in my
iron.
head.
And think of it. There's more mitochondria per cell in those tissues.
Because those tissues can't fail.
Those tissues can't fail. Those tissues have more mitochondria per cell. They are the cells that are repaired quicker than, say, extensor muscle. So those tissues are going to be more nutrient dense. And so he recommends these people, go 30 days on eating organ meat and green leafy vegetables. That's a far cry from, I'm going to live off of hamburger patties.
Yeah.
Well, hamburger patties are easier to get down than liver. But you're not getting much there. So keto. To keto or not to keto? That is the message.
I would say then we could go opposite end. What do you think about, when they are about to do a marathon, you're going to do all the spaghetti that you can eat. And meatballs, of course.
Woo! And garlic bread.
Oh, yeah. Lots of butter.
Number 1. I hope you brush your teeth before you're huffing and puffing in a crowd of a couple thousand people. That would just be rude. Shame on you. Now that we've got that out of the way, that's actually a very good question, because, 30 years ago, high schoolers you'd see the cross-country teams going out and carb loading before a meet, track teams. In theory, that's a great idea, because the carbs take longer to break down into sugar. The sugars then get turned into glucose. The glucose then gets turned into ATP. And in theory, you get this slow burn of energy that they can draw upon throughout the race. And so they say, well, 12 to 18 hours before the race, you do the carb loading. Except, what did those kids always do? You're talking to 15, 16, 17, 18-year-olds, and
Pixie
they
sticks.
eat like horses. Wow. And then in addition to that, they go back to their rooms and they're eating fruit and they're eating candy bars and everything else.
The swim team kids, they bring Jello packets, like
Mhm.
unprepared Jello packets. They'd be eating them like that, or pixie sticks. I don't know if that's a normal thing or if that was just up by me. I never did that when we swam.
The cross-country team that my brother was on, they used to do honey drops, cross-country and track. And so you'd take a mouthful of honey and chug it just before you ran.
Oh boy.
Again, the idea was you get that boost.
Mm-hmm.
Problem is, what happens on the other end of that boost of the simple sugars?
Crash.
You crash. So you're running along feeling great, long stretches, and all of a sudden, and now you're running along like a 1972 Maverick. You can hardly crawl. Well, you did your carb loading the night before. You should be fine.
Simple sugars.
You introduced the simple sugars, and not only did you carb load, but you carb loaded way too much. And so you still have all of that excess in your gut. It hasn't passed through you.
You're carrying 5 pounds of spaghetti on your track.
You're carrying 5 pounds of spaghetti for 3 miles, and you're miserable. So what would the answer be? Okay, we talked about keto, and keto isn't necessarily it. We talked about carb loading. That's not necessarily it. Kind of takes you back to Solomon, doesn't it? Moderation in all things. Yeah. Mo's talking great big circles again. We're back to moderation. If you're going to be getting serious about your exercise, if you even want to just get serious about doing occasional exercise, and you want to incorporate diet, which you should. If you're going to do one, you should do the other. You're not going to lose weight just by dieting. You're not going to lose weight just by exercise. You've got to manage both. It's a lifestyle issue. If you're going to be doing this, you need to be looking at the whole of your diet, not the night before the race.
It's too late then.
It's too late. Not starving yourself. The last jiu-jitsu tournament I competed in, there was a guy who was trying to drop weight for it. The guy owns a CrossFit gym. He knows better. He was trying to drop weight, and so he was starving himself.
That's going to eat the muscle, though.
It's going to eat muscle, and he wasn't drinking water either. So he was starving himself and dehydrated. The night before, he started to eat. He started to drink again. He had one match, and the poor guy was hyperventilating, and we ended up having to call an ambulance.
Yeah.
Didn't get to compete. Blew an entire tournament and almost killed himself. Ended up in the hospital. So the answer is guard your diet, eat clean food, eat 1/3 of your plate should be good clean protein with fats. How much fats? I don't know. Just eat clean, good fat with your meat. If you're looking at your piece of meat and it's got a big old glob of fat on the side of it, don't eat it. But if it's marbled meat, how are you going to cut that out? Yeah, use some common sense here.
But that's a good piece of meat.
That's a good piece of meat. Salmon, fish, something that's clean, though. You don't want the farm raised, and you want to be careful with certain fish because certain fish are higher in mercury. So utilizing the common sense, utilizing the whole 1/3 of your plate, good clean proteins, 1/3 or better dark green leafy vegetables, You mean I can't have iceberg lettuce? You can have iceberg lettuce, but it's not going to do you a whole lot of good.
No.
There's nothing there nutrient-wise. It's a great vehicle for ranch dressing. But beyond that,
It's a filler.
then that last third of your plate, let that be what? Complex starches.
Yep. Fruits
Fruits.
that actually have fiber in them. That's what makes it complex.
Roots that have good starchy complex fibers in them. Good fibrous complex carbohydrates, complex starch. You know what I'm trying to say.
Like if you have an apple, don't just peel it and eat the inside of it. Keep the peel on. That's
peeling.
the fiber. Yeah.
I'm a dad. I can make a dumb dad joke like that. Consequently, you know what it would be if I wasn't a dad and told a joke like that?
What would that be?
It would be a faux pas. Okay, enough of the bad jokes. There's always somebody that wants to argue about sweet potatoes and yams.
Okay.
You know what? It's better than a white potato. Eat the sweet potato. Eat the yam. Don't live off of them because they are high glycemic.
And try to eat a more like a whole one that's baked or something. If you're making it into French fries and you're throwing it in oil, then you're back to square one.
Right.
So.
Right. The reason there's a difference between a baked or a stewed sweet potato and a deep fried sweet potato. What is that difference? The baked potato is going to have all of its nutrients still in there, the baked sweet potato. The stewed sweet potato is going to have some of its nutrients in there, and the rest of them are going to be in the broth. But what happens when you deep fry it?
Oil. You're injecting oil into it.
You're injecting oil into it, and nutrients are get leached out into the oil.
Mm-hmm.
So although it's kind of fun and tasty,
you don't have much there anymore.
There's not much there anymore. That, most of the time, they come out looking like wet socks. Who wants to eat that? Now, then you get into, there's always somebody in a gym who's selling shakes and supplements, right?
Mm-hmm.
You know who you are. and the argument is, well, my performance is great on this. Yeah, okay. I'm glad it's working for you. If it's working for you and it's not causing harm to your body, I can't argue against it. However, it's not for everybody. Mm-hmm. Recently had a patient who was eating a pea protein shake.
Okay.
Now, pea protein is very clean, very good, usually. This individual started taking the shake, trying to get into ketosis, trying to do the ketogenic diet deal. And this poor individual had some severe reactions to the pea protein, a filler that was in this shake that's supposed to be for athletes and is supposed to be clean. And this filler caused this poor individual to have rectal bleeding and severe constipation, not just hemorrhoids, but full-on rectal bleeding.
Oof.
It was a horrible situation. Very sick puppy. Find out what it is, you get rid of it, and the patient starts to heal. Mm-hmm. So you have to be careful with these things. Now, I do martial arts. I do some things. I don't like to run. I like to go out. I like to be outside in nature. I like to be able to have a clear, sharp mind, quick reactions. And so I do look for supplements that will give me an edge. I don't want something that falls into the range of performance enhancement that would, get me kicked out of a tournament or anything like that. But I want something that's going to give me an edge. I'm a middle-aged man. I need some help, for goodness sakes. So I started experimenting with some Chinese herbs. There's a beautiful formula by Evergreen Herbs called Vibrant. And I noticed that when I would take a pretty moderate dose of this herb, not a bulbous dose, but a moderate dose of this herb prior to a workout, my brain thought clearer. I had more stamina. I noticed that when I eat raw bee pollen on a regular basis, I have more stamina. And so for some of my weekend warrior athletes, I would recommend some of these things to them.
Most pre-workout.
Pardon me?
Most pre-workout.
Most pre-workout. But these are things that, number one, there's a lot of good clinical data to back them up.
Mm-hmm.
Number two, there's a lot of good history to back them up.
Mm-hmm.
Number three, there's a lot of good third-party peer-reviewed studies to back them up. Wait a minute, you just said peer-reviewed studies and clinical data. That's because they're two separate things. You can have a peer-reviewed journal article that talks about how drinking too much water is going to be bad for you. And so, Mo, put your coffee mug full of water down. Clinically, though, I know that there's Lyme disease. I know that I'm on a detox. I know that I need to be drinking plenty of water. So these binders and everything else that I'm taking have something to hook onto to get it out of the body.
Mm-hmm.
So, in your face, Journal of Medicine, I'm going to drink the water. See, studies are very interesting because studies, number one, they're only as good as the outfit that's doing the study. If a study, perfect example, 2 years ago, a study came out talking about how coconut oil isn't a good thing. Too much coconut oil is bad for you. It was put out by the canola oil growers. Do you remember that?
Mm-hmm.
Talk about a conflict of interest. That's supposed to get the journal entry flagged and removed right there. So you've got problems with conflicts of interest. You've got the other aspect of it, which is these people are analyzing data from other studies. They're not hands-on with the patients. That data gets skewed, doesn't it?
They pull what they want out of it.
You can pull what you want.
To get the answer or the findings.
So then these studies become very sterile because the reality is the larger studies where they're looking at several thousand people, most of the time are aggregate studies where they're looking at the findings from smaller studies, multiple smaller studies. What's a smaller study? I've read journal articles where it was 3-4 patients that they were looking at. Ideally, in order to be taken seriously, you need at least 32 people. But that's not always the case. So, we talk about studies being the end-all and be-all. I'm sorry, but studies are not the end-all and be-all. Studies are interesting, but studies by themselves become anecdotal because a study is not necessarily the full fruition of the scientific method, which is what we're led to believe.
Like chiropractic, it doesn't have a lot of that kind of backing. We have some, but everybody's presentation is different, and not everybody has the same disc that's herniated or in the same position that it's herniated. Is it that way with acupuncture as well?
It is.
It varies?
It is. There's actually more data on Chinese herbs, more studies that have been done on Chinese herbs because you can isolate compounds within the herbal formula. And very interestingly enough, there's more data and studies that have been done on Qigong exercise and its effect on the body than acupuncture or oriental herbs. That blows my mind. At least that's the way it was 5-10 years ago. That may have changed. So we're talking about studies. So if studies are not necessarily the end-all and be-all, clinical expertise, clinical history becomes very important. So what do I notice in clinical history? I noticed that when I give somebody this Chinese formula, their energy improves, their brain performance improves, they can think clearer, they can function a little better, they have more immediate energy. I came across a product this year, and I use it in my Lyme protocol, Mito ATP. Absolutely love this stuff. This is not what you do pre-workout. This is something that you do all day long, every day. Number one, it's getting certain things out of the body, but number two, it's feeding your mitochondria so that they have something that they can work with.
That they can create the energy.
They can grab hold of that glucose molecule, get it through its 19 steps to turn it into ATP. And so when I put some patient on Mito ATP, they go from being and lethargic to being functional. If I don't take my Mito ATP, I notice that I'm very, very sluggish, and my immune function starts to go down. With it, I can think clearer. I have more energy. Another thing that I like to do in the acute stage pre-workout is the biomolecular oxygen. You absorb it. I mentioned I was asthmatic. It helps my body use oxygen a little bit better. I don't get as oxygen starved when I'm using it. I also have so much more energy because of all of the high energy carbon molecules that are in there. Phenomenal stuff. You can put it on topically for pain.
Like sunburn?
Well, I have something for you, Doc. This is something that works great for joint pain.
Okay.
Speaking of anecdotal clinic evidence, I've actually had a number of people that use this on their knee replacements, and it worked really well. But this is a balm that my wife and I developed years ago, and we no longer make it. But that is great for your sunburn.
Perfect.
Yes, you no longer have to be a lobster.
Miss Lobster.
This lady in Maine is going to be nervous because they're all going to be chasing around with, what do they call that? Drawn butter?
Oh.
Reduced butter?
I
blew the really good joke there. Correction. I blew a really moderate joke there. But there are things that, from a clinical perspective, have worked not just on me, but have worked on.
Smells good too.
That's nice stuff. Mm-hmm. But they work on patient after patient after patient after patient. Why haven't I done a study on these and written a paper? Because who's got the time for that?
If it works, it works.
If it works for my patients, I know it works for my patients. If I know of other athletes that use some of this stuff and it works for them, the ultra marathoners, they love the Rescue Balm as a glide, because as you're running after mile 75, I think he says, skin starts to get a little bit raw.
Yeah.
So these are things that we have available to us as practitioners, things that we have learned as practitioners that help us and help our patients. Which then also brings to mind, if you have a healthcare practitioner that, doesn't seem too googly-eyed in your gym, it might be worth sitting down and having a talk with them. Mm-hmm. It might be worth saying, hey, can I get an appointment with you to just sit down and go over some of this stuff? 9 times out of 10, they'll talk to you all night long, right there at the gym. Mm-hmm. So I can't tell you how many times I was late to get home because
somebody got you.
Somebody would get me and start asking me questions. Anything you want to add, Doc?
You hit a good majority of it with that. It's just, you look for the whole foods, complex carbs with that, the good sources of protein with lean fat. You can have some fat, but you don't want it the majority. Have good food that's going to actually nourish your body, not food like substance.
And if you're going to use a supplement or something like that, do something that has a good history behind it.
Mm-hmm.
Don't do something that, some guy in the gym says this is great, and then you find out later that it's really messed you up.
Yeah.
Or you've been, throwing $120 a month at this stuff and it's done absolutely nothing, which happens all the time.
Oh, yeah.
The other thing you got to keep in mind with all things sports related is a doctor colleague of ours, when I was in school, was telling me about a friend of his who they were in their 50s, and his friend came to him and he says, "I'm getting old man armpits." And, well, just start doing some exercises, start doing some push-ups. So his friend was back about a week later, could hardly move his neck, could hardly move his arms. And turns out that the guy went out there and started overdoing it, we'll say, and trying to get rid of the old man armpits. I still don't know what that is.
I was trying to picture it the whole time you were saying it, but I'm not sure if I was picturing the right thing or not.
So the thing to keep in mind is when you are starting any exercise regimen, don't let your vanity get in the way.
Moderation.
Your vanity is going to kill you. Your vanity is going to make it so you can't exercise. Moderation, having some wisdom and saying, you know what? I don't need to go running 10K today. I'm going to run. No, I'm not going to run. I'm going to find something better to do. I'm going to go paddle a kayak. Incremental results. You don't want to be covering and improving 100% today. That's going to cause too much damage.
Mm-hmm.
What you want to be improving 1%, 5%. If I can be 5% better than I was last time, great. Because after 100 days, you're 500% better than you were.
That's right.
It's basic stuff. You can turn on any old jerk on YouTube that's giving you motivational speaking and learn some of this stuff. It's common sense. You don't have to pay anyone for it.
Mm-hmm.
Take it slow. And whenever I see somebody out jogging or showing up at a gym and they're severely overweight, man, that touches my heart. Number one, the courage that individual has to say, I got to make a change. Mm-hmm. This ain't right. I need to change it. Number two, the courage to be out there and working at it, knowing that everyone's going.
I think a lot of us feel that way, though. It's more like, good for you.
Yes.
I think, but people go into it thinking like they're being self-conscious about it. But that's the reason we go in, is to work on our health.
And exactly. You don't go in, at least you shouldn't be going in, just so that you gratify your own vanity. That's not what it's about.
Mm-hmm.
It's about moving your body, getting that lymphatic drainage moving out the stagnation, because stagnation is what breeds disease. In China, we live in a culture where cancer is epidemic. And what is cancer in Chinese medicine? Cancer is stagnation. Toxic heat from stagnation. Move your body. Eat clean. Use common sense.
Yeah, and a lot of people don't have the physical jobs, like we said. So you have to put that extra effort in outside of work to do that.
Well, and even those folks who exercise a lot at work, Okay. You might be doing something very physical and strenuous, but it's only working a certain group of muscles in your body,
because it's repetitive.
and you need to change that. You need to get out there, and you need to be making sure your body's moving in all planes of motion. A great place to start, doctors always say, you got to get out there and walk 20 minutes a day. That's a place to start. You don't want to stay there. Why? Because if I am walking, the old Jack Benny movement right here, right? If I'm walking, all of my movements in one plane of motion, my shoulders are moving like this. My hips are moving in that same plane of motion. My knees, my ankles. There's nothing like this.
Mm-hmm.
There's no rotation. So all of those non-vascular tissues are only getting nourished in one aspect of them. You need that full rotation.
Like Qigong.
Like Qigong. Like going and taking a karate class. I don't care if you're 72. Take a karate class. If the dojo says, I don't know, you're too fragile, then it's the wrong dojo. Find some place that is going to say, yeah, come in, we'll work with you. Find some place that has more of a team spirit that says, come on, we'll work with you. We'll get you up to speed. We'll get you where you can be. I always thought it was great when you'd go to a karate tournament and you'd see the seniors doing their kata, their forms. They don't have the range of motion anymore like some of the younger guys, the young flashy guys flipping around and stuff. But their forms were a lot more traditional. And you could see the injuries throughout the years on some of these people as they're moving through their range of motion. But they're moving through their range of motion, which not every 72-year-old can do.
Mm-mm.
So move your body. If you're somebody who's out walking every day, that's a great place to start. But don't stop there. You've got to do more than that. You owe your body more than that.
You do.
Because if you are only moving in one plane of motion, you're going to develop arthritis. If there's Lyme disease, if there's Babesia, if there's Bartonella, if there's heavy metals, if any of this stuff is in your body, and I guarantee you for most of you it is, then you've got to try to move your body to get that inflammation moved out. And you've got to be doing it with some wisdom. Now, we've got 10 minutes left, and this is the time of our show where you get to ask the questions. So we are opening it up for questions, and we're yet to have anybody use the live chat. Well, no, we had Ed once use the live chat on YouTube to ask a question. Keep in mind, you can ask your questions using Facebook. You can use the comments. You can use the Facebook chat. You can use the YouTube chat. You can send carrier pigeons. You can do phone messages. Do they still do telegrams? I don't think so. And I don't do Morse code.
No smoke signals.
No smoke signals. I'm dyslexic and asthmatic. I'll wheeze out of sync. So this is the time of the show where we get to answer your questions, and we'll give you guys just a couple seconds to get a question in. Let's see what's coming in on the eyes pad. Okay, here we have something. I'm thinking about doing a triathlon by the end of the summer. I haven't done any exercise to this point. I would like to get started. Help. Well, number one, good for you, deciding to make a change. Number two, A triathlon is very specific.
Mhm.
You're doing the swimming, you're doing the biking, you're doing the running. Now, I'm assuming you can swim, and I'm assuming you can run. I would say start small. The biggest thing that I would say to work on would be make sure you can swim the distance. A lot of the triathlons around here are in little ponds and lakes that aren't that big of a deal, but sometimes you get out on Lake Michigan or like Lake Monona. I think they have one up in Madison.
That's a whole different ball game.
That's a whole different ball game. So depending on which triathlon you're going to be getting into, train specifically for that one. Start small though. Start now with guarding your nutrition, planning your nutrition, eating clean, talking to one of us about supplements that you can be doing to minimize your inflammatory response to your workout. Talk to someone like Dr. Noel, who's very good with exercises and stretching to help aid you in warming up for your workouts. That pre-workout warm-up is so important. It kind of amazed me when I would hear about some of the different jiu-jitsu schools that you go to, and they spend an exorbitant amount of time warming up.
It's underutilized for sure.
It is. It's not necessarily fun, and it's not what you're necessarily there for. But if you injure yourself, you ain't going to be doing that triathlon. So start small. I would say work on the swimming first, and keep in mind with the biking and the running, that's all in one plane of motion. So if you're also doing softball on the side or something like that, be careful, because you are strengthening muscles again in that sagittal plane of motion. If you strengthen these muscles out of symmetry, and you're going to go steal a base and you go to start to sprint, you're going to tear something. So be very careful. Be very judicious about your gradual increase in distance and intensity. Manage your diet. Manage your nutrition.
And if you can get out on the course that you're going to be on, even better. If it's on Lake Michigan or you're on the bike trail, try to recreate it the best you can.
Yeah. Watch your electrolytes when you're out training. We're in the summertime now.
It's getting hot.
It's hot, and it's not just hot, it's muggy. And so as you start to move and you start to exercise, what happens? You sweat. And so when you sweat, you start losing your electrolytes. And electrolytes are those little minerals that our body needs to create these pathways to make ATP and some other things. And without the electrolytes, you're no longer making ATP. You're no longer utilizing the water in your body. And even if you're guzzling water all day long and you're short on electrolytes, your body's not using that water. Chinese, we call that yin deficient. By the way, let me just clear up a little pet peeve. It's not yin and yang. It's yin and yang. Okay. Sort of like when you're talking to a Brit and they say, aluminium. It's not aluminium, you ninny. It's aluminum. Say it like an American.
I think that's a whole nother show that we could do with that. So.
I think so. What are we doing next week? Oh, that's right. Ear infections.
Ear infections, yeah.
I wanted to complain about the Brits.
We'll throw that in somehow.
I think we could fit it in. I just had a wonderful epiphany. Anyway, do you have any questions coming in on your phone?
I did not.
Okay. So I hope that answers your question about the triathlons. Make sure you're disciplined about your exercise. The worst thing you can possibly do is to go too hard in the front end and hurt yourself, or not do anything on the front end and just kind of skate by and do little amounts that never incrementally get stronger. Then you get to your triathlon and you die and you hurt yourself. When I trained Krav Maga, I think we trained for a year and a half, 2 years before we were allowed to test for a belt. And we went over, a couple of us from our gym in Madison went over to a place in Milwaukee where they were having a belt testing. And we trained hard. And I was training jiu-jitsu, I was training Krav Maga, and I at that point, for the months leading up to the test, I was training sometimes 6 hours a day, 2-3 days a week jiu-jitsu, and 2 hours a day Krav Maga. So intense cardio, intense. And I got to this Krav Maga test. And the whole point in Krav Maga, that first level, is where is the person's breaking point? Never, ever, ever get in the first group to test. Those are always the go-getters. Let them go get it. Get in one of the follow-up groups where they say, oh, these poor guys are doing the best they can. It was 4.5 hours of high intensity, no breaks. They gave us a 30-second water break after 2 hours. It was horrible. Had I not been training at the level that I was training, I would not have finished, and I would have been ruined. As it is, my calf muscles were shredded for about 3 weeks.
Oh, I bet.
But it was intense. It was brutal. Your triathlon will be like that. Prepare for it. Figure out how many days you have. Figure out how much to incrementally increase so you can cover the ground. And if it's a full Ironman style triathlon, don't start there. You're biting off more than you can chew.
Baby steps.
Baby steps. We've got to check our pride at the door and say, this is what I can do. That's what I want to do. Don't. A rabbi once, I heard him say, don't give up what you want most for what you want right now. He had it under a different context, but it is rather profound. So it's 12:59. We've rambled on for a whole hour, and 4 of you have stuck with us. You have wasted, again, a perfectly good hour. Hey, we haven't gotten a letter from NPR. We can keep using that till their lawyers send us a cease and desist letter. We've made it through the week. We've made it through another broadcast, and you've stuck with us. So I thank you. From all of us here at the Siloam Center for Traditional Medicine and Traditional and Integrative Medicine in Janesville, thank you for watching. And next week is ear infections, pediatric ear infections. I hope this show is helpful to you. If there's some content that you would like us to cover, make sure you get a hold of us. And we will see you next week. Shalom and be well.
Bye, guys.